Thank you, Harriet, for introducing me, and thank you to ACE for inviting me. It's my great pleasure to come here and talk to you about digital nudging in healthcare. So mainly, I want to approach this topic connecting with the last speakers to tell you about how understanding the humanity of our patients can really help us to bring out that quality and sustainable healthcare system that we all seek to have. So digital nudging in healthcare, addressing patient health literacy. Let me first start with the context. In 2008, the World Health Organization Director General wrote an article in Lancet saying, "We all know the numbers." And what he meant when he said that statement was that non-communicable diseases, so your cardiovascular diseases, diabetes, chronic respiratory diseases, cancer, and so on, are responsible for 41 million deaths each year. By 2030, they're estimated to have a global economic impact of $47 trillion. And therefore, one of the UN Sustainable Development Goal is to try to reduce premature mortality by 1/3 through prevention and treatment. And it's with this context in mind that the topic that I'm going to speak about, started being raised. There you go. So from the 1970s onwards, people started using this term health literacy as part of value-based healthcare. And what do we mean by health literacy? Defined as the World Health Organization infographic shows, health literacy is giving patients the ability to assess, understand, appraise, and use information to make healthy choices for themselves. And in today's context, health literacy is often spoken about as a cost-effective approach to managing non-communicable diseases. So, for example, you have a patient with type 2 diabetes, and health literacy gives them the tools to answer questions like this: how do I make better food choices? Or what about cardiovascular diseases? Health literacy provides them the tools, once again, to answer questions like this: what lifestyle behaviors can I change? Should I attend a cardiac rehab program? In fact, health literacy is thought to be so key to value-based healthcare that the World Health Organization has called it an instrument for reaching their Sustainable Development Goal targets. So let me expand this concept a little bit by telling you about the elements of health literacy. Exactly what do we mean when we say health literacy? And typically, we think of three things. Knowledge. Do I give patients the ability to understand their health and health systems? For example, their medication routine, having a healthy lifestyle, health services, and scientific thinking. Are they able to process information? So with the information that they've given them, are they able to actually process this information and therefore to rightly change their actions? And finally, self-management tools. Have you given them all that they need in order to manage their health conditions? So the three key elements of health literacy. So implicit in what I have told you so far is that when we talk about health literacy efforts, we assume that if our patients simply understand all this information, then they're going to change their behavior, and that's going to lead to better health outcomes. And therefore, our approach with this assumption in mind is to focus on education. We come up with tons of pamphlets, with websites giving information to try to change people's minds. So remember, the model is, if you have all these tools, all you need to do is to understand. You will then change your behavior, and that will lead to better health outcomes. But the problem, as we have seen in this morning's talks, is that we are humans, and humanity throws this model into question. For example, many of us know that we should probably be exercising more. And yet we don't do it. Just the mere information is not enough to drive us to perform that behavior. Many of us probably know that we should have a great sleep routine where we sleep at the same time every day and wake up at the same time every day, and we get our full, how about 6 to 8 hours of well-rested sleep. But we know we don't do it. It's 11 p.m., we click on that Netflix show and watch that Korean drama for another 2 more hours, and at 1 a.m. we go, oops, I should have slept 2 hours ago. We are humans, and humans throw this model into chaos. And so, we are not all rational and self-controlled, and therefore, it is not the case that understanding alone drives health behaviors that will lead to better outcomes. There is, as psychologists call it, an intention-action gap. Name your health behavior, and we fall short of it despite knowing that it's good for us. So, as an alternative approach, what I want to suggest to you is that we should be nudging health behaviors instead. In other words, after patients have received the information that we want them to have, stop giving more information. It's time to nudge and help them to bridge the intention-action gap to change their behavior and therefore to result in better outcomes. In other words, the approach of nudge that I'm going to tell you about is trying to change behavior without focusing on changing minds any further than we've already done. And so let me give you an example. Right now, I'm working on a project to help patients self-monitor their vital signs. So the clinicians around in this room would know that we often tell patients to monitor their heart rate, their blood pressure, their vital signs at home, particularly after, for example, you've had a stroke or you've had some chronic illness. The evidence tells us, a review of 17 meta-analyses show that this behavior, a simple act of monitoring your vital signs at home, reduces readmissions to hospitals, improves patient care, and so we want our patients to do that. So what do we typically do? Our typical approach, is we have a patient come to us and we give them information. We tell them, we want you to monitor your vital signs every day and we want you to chart it out. And here are the benefits, 13 reasons why you should do this. And the reason I'm working on this project is that, I've been told at the next visit, when the patients come back in, you discover that they haven't done that. They haven't been monitoring their vital signs. So our typical approach is kind of nag them, right? To say again, here are the instructions. I want you to monitor your vital signs. And again, here are the benefits, the 13 reasons why you should do this. What I want to suggest to you is the alternative. Can we nudge and not nag? And so I put here before you a framework that is very much used in behavioral science from the Behavioral Insights team called the EAST model. That means 4 simple rules of nudge. Can we make the target behavior easy, attractive, social, and timely? Just following these 4 rules, we can try to promote the health behavior that we seek our patients to complete. So make the target behavior easy, attractive, social, and timely. So let me walk through each of these examples. So the first question you want to ask is, can you make it easy? So if you talk to patients about why they don't monitor their vital signs, for example, they'll typically tell you, oh, it's so troublesome. I don't have a blood pressure monitor in the first place. There's all these barriers. And so the best thing that you can do to promote this behavior is to make it as easy as possible. In fact, this is so important that it's actually circled out in blue as in the model because it's the basis for what all the other techniques hinge on. So make it easy. There are a couple of ways you can make it easy. Number 1, you can try to reduce the hassle. So for example, along with telling your patients to monitor their vital signs, can you also provide them the equipment to do so? So that they won't say, oh, now I have to go out and buy one and it's so troublesome. The second thing you can do to make it easy is to simplify your instructions. For example, if you can just narrow it down to just 3 simple steps, for example, they're much more likely to take up this behavior. Finally, a common strategy that is used to make things easier is to have defaults or preset options. It doesn't really apply to monitoring vital signs, but yeah, in any other behavior that you're trying to encourage, if there's a way to make it, to set a default or preset options, that again makes things easier for your patients. The second question that you should ask is, I want to encourage this target behavior. Can you make it attractive? And the goal over here is to make it attractive so that you capture people's attention. And the literature tells us that there are 2 ways that you can make target behaviors attractive. The first is through the psychological aspects, for example, by providing small rewards. And you can see over here, this is an example for Omron, where Omron has said, if you monitor your vital signs regularly, you can chalk up points and claim gifts from us. Okay, so Omron is the people who make the blood pressure monitors. And you can use small rewards like this to make this option more attractive for patients. Of course, you can also draw people's attention and make it more attractive through the physical aspects. When I was doing my research for this talk, I found that all the blood pressure monitors that you see in the market are boring and white and gray and easily, it's easy to miss. So if you can somehow make it more colorful, it grabs your attention and it's much harder for them to miss, and therefore more likely for them to adopt this vital signs monitoring behavior. So, question number 3, can you make it social? So we know that if you tag a behavior and you make it social, people are, again, much more likely to perform that behavior. So I give you an example over here. Activo, which makes blood pressure monitoring devices and has an app, uses social networks to encourage people to monitor their vital signs. For example, you can see over here, you have a scoreboard of some sort where all your friends can post up their vital signs together. So we know that if people can share their readings, have a scoreboard, have some sort of team challenge, the social nature of the behavior is going to make them more likely to comply. So it applies to exercise, for example. If you want your patients to exercise, can you make it more social in a fun with your family, and so forth? You can also make it social by citing social norms. This is kind of like peer pressure, right? By saying 7 in 10 people do this behavior, you should be doing it too. You can also make it social by having people make contracts to others, right? So in other words, I pledge to do this. People are much more likely, once they're given their word, to perform that behavior. So let me move on to the 4th principle. Can you make it timely? We know that there are certain time-related aspects that will help people to perform their behavior. The first is what we call the fresh start effect. People make New Year's resolutions on 1st of January. People on their 40th birthday, their 50th birthday, but in the context of healthcare, often after a hospitalization visit. All of a sudden, everyone's very motivated, and that's the best time to encourage people to start a new habit. Another aspect of time that we should consider is that people tend to discount things in the future. We call it time discounting or temporal discounting. If you tell people, you should exercise because, in 5 years' time, you'll reap the health benefits, no one gets it. Everybody will push it off and say, but today I want to watch Netflix. So you've got to try to find short-term goals that they can, and short-term impact that they can monitor and look forward to. And finally, another aspect of timely is to address the intention-action gap. So, for example, you can ask your patients, in the case of vital sign monitoring, to set an alarm in the morning when they're at home and with their equipment. There's no point setting an alarm for 12 p.m. when they're out, and they will forget all about vital sign monitoring. So getting the timing right is very important. Oops, sorry, I didn't realize the slide wasn't up. Okay, so these techniques that I've told you so far, Harvard Business School has analyzed the statistics and say that you get your bang for the buck. You go from 30% from just giving information and people performing that behavior to 80% by using all these techniques that I've told you about. So that's great. We get patients performing the behavior that we think is good for their health outcomes. But so far, I've been telling you about non-digital nudges, and this talk is about digital nudges. And mainly I want to tell you that if we use digital nudges, it helps us to optimize our nudging and to scale up. Why? Because we get richer user information and customization, and therefore we can personalize our nudge, get the timing even more accurate, and we can monitor. We can experiment, try different things, get feedback and tweak our nudges, and of course, scale up to have a larger reach. Let me give you a couple of examples. We see digital nudges in everyday life. For example, if you go to agoda.com, flights have resumed and everyone is booking their flights, you see at the top of their image that they say things like, hurry, 51% of properties on our sites are fully booked, and they'll tell you this is popular, last booked 3 hours ago. Here, of course, they're using a social nudge to try to get your attention. Or how about these ones, where there are pricing plans and one is clearly set as the default to make it easy. It's the more expensive one and they want you to pay for that. So again, a nudge to try to get you to do what the business wants to do. But in the healthcare context, we also have examples of digital nudges. For example, text reminders for appointments. These days, if you make an appointment at the polyclinic, you get a message like this. Dear so-and-so, you have an appointment, this is what time and where. It's easy, so that you can see all the details at a glance, and it's timely. It's sent to you very close to the appointment. And what we've found in a meta-analysis of all these trials where SMS reminders are given is that, yes, it's very effective. Almost every study that was analyzed showed an improvement in patients coming for their appointments. A simple act made change people's behavior. How about this one? Right now in Singapore, there's this Healthier SG roadmap that has been launched, talking about how do we encourage our population to improve their lifestyle habits? Well, can we nudge healthier food choices? So let me give you an example of online shopping in the Netherlands. This is a platform called Nako BV, and you see your standard display that really looks like Redmart, right? Like you can put options into a cart. In the nudge condition, let's imagine that somebody picked Coke that they want to put in their cart, and you get this nudge. And you can see over here, the person shopping is shown the alternative, the diet-free Coke. It's very attractive, right? It's put in right in front of your face, and it's very easy to swap your standard Coke for your sugar-free Coke. All you have to do is to click the button, a very large button that says, good idea. And it's actually very hard for you to refuse this option because it's a tiny X at the corner. And so in doing this, we nudge our consumers to have healthier food choices without necessarily changing their minds. And this, the study found, was effective. Not very big effects, but still effective in reducing the amount of unhealthy choices and increasing the amount of healthy purchases. So, just as the timer clicks that my time is up, let me give you a summary of what I've been saying so far. Traditionally, we address health behaviors by trying to change minds. But anyone in this room who has worked with patients would know, or has worked with your own health behaviors, would know that that is an uphill battle. When we embrace humanity and understand how humans think, okay, and how difficult it is to bridge the intention-action gap, then we roll up nudges, and in particular, digital nudges, and we find that they are a low-cost solution that allows us to influence behaviors without necessarily changing minds. And I want to emphasize that I've talked about this in the context of patient behavior, but really it can be used for any behavior across the healthcare system, for patients, for caregivers, but even for healthcare professionals, if you want to change behavior and urge behavior in a certain direction. All right. Thank you, everyone.